Scott County, providing safe, healthy, and livable communities.
Today about the Crossover Youth. As you probably saw from your packet as you read it this weekend, this is a new program that they're working on based on data that they've seen and are in the process of getting some baselines and then measuring data going forward. So it's going to be a little bit different again than some of them we've seen that had years of data, but it was based on some discoveries, information they found as part of the board strategy coming out of 2013 that they started to move this forward. And so with that, I'll introduce myself and this side, the questioning side of the panel. The other side over there, the folks talking about their information, then get 4 to 6 minutes to talk about their data and their program, and then we'll open it up for questions. We'll then open it up to the audience for questions, and then to the board to conclude and ask questions and information that they have. So with that, I'm Leslie Vermillion, the Deputy County Administrator.
Jennifer Schultz, Office of Management and Budget.
Scott Anderson, IT Manager.
Jen Schwartz, Health and Human Services.
Julie Swanson, I'm one of the Child Protection Supervisors.
Terry Raditz, Mental Health Center.
I'm Patrick Miller. I'm a detective with Savage Police Department.
Carrie Lorenz with Community Corrections. I'm one of the supervisors there.
I'm Steve Brown. I'm the supervisor of the Crossover Youth Case Manager and supervise children's mental health and chemical dependency.
And I'm Tim Cleveland, Director in Community Corrections.
I'm Sarah Windorf. I'm with the County Attorney's Office.
Okay. And part of our team, Suzanne Artsland, wasn't able to be here today, and so she asked if I could start out today. And I certainly hope you don't want me to talk about technology or we're in big trouble. So Crossover Youth refers to those youth who have a history with children's services and are now crossing over into the juvenile justice system. And as Leslie indicated, our initiative with Crossover Youth came out of our county board strategy work group on mental illness, decriminalizing mental illness. As part of that work, we looked at intense case studies of 3 to 4 deep-end individuals who had been through the system and were well known to all of us, to adult mental health services, the mental health center, social services, corrections, and frequent flyers in the jail. And what was interesting in this analysis is that all of these individuals had early contact with child welfare services, child protection, and or children's mental health. About the same time as we're involved in this study, NACO, the National Association of Counties, came out with a very interesting article about why counties should be concerned about dual status youth who are involved in both the child welfare system and juvenile justice. In this article, they stated that a child who suffers abuse or neglect is 59% more likely to be arrested as a juvenile and 28% more likely to be arrested as an adult. Dual status youth are younger at the first time of their arrest, and once they're in the juvenile justice system, they return twice as often as youth who have not had that history, and they spend more time in detention, which is a costly thing to be concerned about. And also, when youth that have had that history of trauma are detained or placed, it adds to that trauma and it makes them even more prone to deeper involvement in the system. That article went on to say that dual status youth have an increased risk of mental health issues, education problems, unemployment, and substance use disorders. And in that article, they had some specific examples. King County, Washington, they did a study, and 60% of the youth referred to their juvenile justice system had some prior involvement with child welfare system. Newton County, Georgia, 56% of its youth were coming into the juvenile justice system had history with child welfare. So what we did in our work group is we wanted to see if this information, this data, held true for Scott County youth. So we did an analysis, and if I could draw your attention to slide number 6. So we looked at 46 youth who were between the ages of 10 and 15 and who were petitioned to juvenile court for some type of crime in 2014. What we learned when we analyzed that data and shared with social services is that 27 of these youth, or 59%, had a prior social services history. What was interesting is out of that 27, 17 out of the 27, or 63% of that subset, ended up in some type of placement, primarily detention. And those 17 youth, we've tracked them over a period from January 1 of 2014 to June of 2015. Those 17 youth ended up in 67 different placements. So they might have started off at the Jeff, ended up at the Dakota County Juvenile Detention Facility or in Carver, for a total of 1,164 days during that time span. And why you should be concerned is that resulted in an actual cost to the county of $234,000 in placement costs. That same subset, only 10 out of the 27 had no placement history. Now, if you compare that to the 19 youth during 2014 who had no social services history, only 1 out of the 19 ended up in placement. That's less than 5% of that subset. And that one youth ended up in 7 different placements for a total of 55 days. Compare that to 18 out of the 19 youth who had no prior social services history, had no placement. They never went into detention. So in fact, this data in Scott County mirrored exactly what the national statistics were showing. And that led us to the Crossover Youth Initiative. So I'm going to turn it over to Steve.
Thanks, Tim. You read a lot of the same articles I did before because you shared a lot of the same stats, so thanks for doing that. I'm going to share a couple of bullet points in terms of setting that up as well. The Crossover Youth Program is, there's a Crossover Youth practice model that's developed out of the Georgetown University. And so Tim shared that it's an intensely researched population to show that there's a great need and we can make great improvements by seeing kids very different than adults, because we know that kids are different neurologically, developmentally, and socially. And so we adopted our model from the Georgetown University with the scant resources that we had, trying to integrate best practices. We went to Stearns County, learned a little bit about their model, and so here we are today with a very new model. So I'll talk a little bit about what does our program in Scott County look like, and then we'll open it up to the panel for questions. We're targeting first-time offenders and from ages 10 to 15 with low to moderate offenses. Of course, those who are dually involved, if they're currently involved in social services or have had a previous involvement in social services with a first-time offense, then they become eligible for our program. We provide trauma-informed mental health assessments. We provide social service assessment to find out what the needs and strengths of the family and the youth are and help them mobilize resources to get involved. We develop a diversion plan. What might involve some accountability pieces in terms of helping kind of make some victim amendments in terms of apology letters, in terms of community service, or other creative things that might help make their wrong be a right, and also teach the youth about the impact of their behaviors. The youth comes to our program actually we developed a Crossover Youth Review team that directs the program's operations in terms of policies and procedures. We work together on that, being multidisciplinary, so we share our expertise to each other. But this team also engages the youth in the family as they come in, and so we're asking the youth, do you know why you're here? Do you understand the impact of your behavior? Also a support message saying there's hope for change, and if you work with us, we want to work with you, and we can help support you to get involved and stay out of the legal system, knowing that charges for juveniles last into their adulthood and create barriers for jobs and housing and education. Other points, so our Crossover Youth team reviews every 60 days, so they come in, so there's lots of accountability. We have a Crossover Youth case manager who meets with the youth and the family at least one time per month, checks in, are they following rules at school, are they following rules at home, they're connecting with the police departments, are there any new charges, and so that information is relayed back to the review team for consideration if we're being effective, whether we need increase the intensity of services, and whether the program continues to be appropriate for them. So with that, I'll turn it over to the panel.
Thanks, Steve.
You bet.
All right. While we're on this slide, if I could just ask, to what do you attribute the huge difference in placements between those two groups? Why does the the social service group have such a higher placement rate?
Terry, you want to take that?
Oh, sure. What I would guess about that, knowing a lot of these youth and knowing the case studies that we did, is the complexity of the behavior. It's not just a simple, go out, have bad judgment, commit a crime. There's a history usually of some, could be some issues in the family, so not a lot of support at home. Also, there are mental health issues that may contribute to the judgment and the behaviors and the impulsivity, as well as sometimes some chemical use, some chemical addiction or chemical use. So the behaviors are much more complicated, and the presentation is much more complicated. So reacting to that and changing that is more difficult than with a typical youth.
Generally, when kids get in the system, it's hard to get them out of the system. And so kids who are abused, neglected, are kids who experience trauma. And we know that trauma has an effect on, just development, just normal development in terms of puberty. And we know that kids have poor self-control, their executive functioning doesn't work very well, and so they're highly influenced by social peers. But when they have trauma, they even struggle more. And so a kid who's been involved in social services, either through child protection or some other means, we know those kids are even higher risk. And once they're in the system, and once they go to process legally, we know that, at least the research shows us, those kids are in detention longer, they're in on-home placements longer, they're in more placement settings, and sentencing is generally harsher. And so for whatever reason, there's some kind of a bias or concern that we're trying to provide more services to these kids.
So just keeping on the slide, and I think this is the 14 to 15 data. And so 60% of the kids they have the crossover between the social services and the delinquency. And I think I read currently you have 4 participants in the program. And I recognize it's a new program. Is that where you would expect to be at this point with our numbers? And if not, are there barriers that you're seeing or things that are difficult for more kids to participate? Because it seems like it makes a lot of sense.
It'd be really easy for me to respond to all these questions, so I'm going to pause for a while. Anybody else want to field that one? I started out. The Crossover Youth Program isn't about providing case management. It's not about providing mental health center or mental health assessment with trauma informed, because we do all of those things now. And really, the Crossover Youth Program model is really about integrating services so that we're working together, that we're seeing kids differently and we're responding to kids differently. And so everyone at the table here does an excellent job in the services that they provide. What we're doing now is trying to figure out how do we work together and how do we develop a response to these youth that's going to be helpful, and trusting that that's going to actually be an effective way to do that. And so some of it is just working together to identify those youth. And so I'll leave it at that. I don't know if, Sarah, you want to respond to some of that?
The county attorney's office is the agency that is responsible for the referrals to the program, because we're the ones that are getting the police reports and getting the referrals for possible charges in the juvenile delinquency system. And so the referral process can come at the time an arrest is made of a juvenile, or it could come at the time we get paperwork in from any of our various law enforcement agencies that charges are appropriate. And once we get that information in our office, if we have information that this child has prior social services, mental health, case management, we will then bring a referral for the program. And at this point, I don't see any barriers to any referrals. I think it is because it is such a new program, and the child that comes in for a referral must be a first-time offender. We're really focusing on the 10 to 15 age range, and once we do have all that information, and we do deem it appropriate, we will bring it to the group, and then we bring it to the group to see if programming is appropriate in the Crossover Youth Program. But we get information from, Brian Moss is the primary public defender in the juvenile court system, and he will certainly contact myself or any of the other juvenile attorneys in our office and say, hey, can you look at this person? I'm getting information from whatever collateral context I have that this could be an appropriate person. We could get information. The main part is usually from our law enforcement agencies when they do make an arrest or they do have that contact with that child. So I think that we're all working together very well to collaborate and to establish all that information. But it is new, and when we deem it appropriate, we are referring the appropriate kids to the program.
So it's only if it's their first offense. If they reoffend, as I've been following these is it offender court ones, sometimes they relapse or have an issue and we continue to work with them. So if it's a second offense or something, they're not part of the program then, or?
That's a really good question. That's something that we're currently working on now. Technically, according to the contract that we have the child sign, if they do reoffend, as is with many diversion programs, they would not be eligible to continue in the program with those subsequent offenses. We're working on trying to establish that now, and that's kind of a work in progress that the group is trying to figure out what's fair and reasonable under all the circumstances, and trying to give enough time to have the mental health services and all the other programming that we're offering, try to see can that make a difference and not jump to too much of a judgment too quickly. But that being said, we do want to abide by rules and our policies that we spend so much time coming up with. But I think that is going to, time will have to tell to see how we're going to handle those subsequent offenses while they are still in our 6-month program. But technically speaking, yes, it is for first-time offenders, and subsequent offenses would technically go into the juvenile court system. But that's something that it's kind of a gray area that we're still working on right now.
Yeah, being a new, I think that's the nature of having a new program, is we, in paper, we got the manual, we got the forms, and now we're putting it into practice with real lives. And so we're going, oh, hold on a minute, what does that mean? And so we're having more of those quality conversations in terms of what's the impact of the program, what's the impact of the kid continuing. And so I think that's the newness of the program.
And just a point of clarification, the 46 youth that we looked at were not necessarily first-time offenders. So it doesn't mean that out of 2014, 46 would have been eligible. So.
Can referrals also come in from probation or child protection or mental health for you to review and consider, or is it really just come from when the offense happens?
Well, we, certainly can screen if they come out to the JAF, or Carrie and her staff can bring that information forward if for some reason it didn't come forward. So
that probably more applies to those kids that end up in detention on a 36-hour hold. Those just happen really quickly. Okay. And so part of that process is our office handles notifying the parent, collecting all the kind of background information. So at that point of collecting that, we may connect with the attorneys and say, hey, this kiddo might be appropriate, just because parents have mentioned prior involvement, or we know they're open upstairs. But for us, we're kind of on the back end of it for just the kids that come through on a charge that come just regular court process, so we wouldn't be involved in that.
Okay. And because this is a new program, getting the word out to patrol officers that are dealing with the kids, especially the school resource officers and stuff, they're just starting to get wind of it. They're the ones that see the kids every day, and they're like, this kid, he's going down the wrong path. So, with the discretion that officers have, there might be a kid that's made a poor mistake, but they decided not to charge them for whatever reason. Maybe it was to try to keep them out of the court system and stuff. Well, now this is a program where they can get a hold of us that are on the panel, and we can bring it up to the group to say, hey, maybe the kid wasn't placed in JAF, but he was placed with grandma instead for the night, just to have things simmer down at home. But it could have gone to a charge. And then we would discuss that where we don't have the criminal charge side of it, but it might be a candidate for the program.
So I saw on one of your slides that detention has potential adverse effects for the kids. Do you take a look at the whole home situation too, to make sure you're sending them back to a healthy home?
When we do we do diagnostic assessments on everyone as soon as they're referred to the program. And part of that is looking at the family dynamics. And we talk with the parents, and we also screen for chemical health.
Well, it's kind of the design of the multidisciplinary team as well, that, you know, if we're open to case management, we're missing something, we've got the mental health center going, well, hold on a minute, are we looking at the big picture, are we looking at family dynamics, or we have child protection looking at, well, we've had other previous reports, we've been open in services before, and so we can have that discussion in the review team in terms of what are the factors driving the offenses, and are there other things to consider in terms of really assisting the family. So the outcome of a review team might mean, well, we might need to change the direction we're moving with crossover youth, and maybe we need to consider more of a child protection response or a CHIPS response. And so we can kind of ask those questions and have that dialogue in the review team.
Okay, and it would be interesting too to see, you know, of the ones that do end up in placement, how many of them have parents who have been through the correctional system as well? Is there a correlation there, do you know, or is it?
I would say yes.
Anecdotally, yes.
Yes.
So Tim, one question I had goes to literacy, and it's because 50 by 30 runs in everything I do these days, it seems. But these kids, how did they do in kindergarten, prep, and third grade reading? And the one I was curious is the school district, is there somebody at the table from the school districts from this? So from a, you know, we know literacy and criminal behavior go hand in hand as well. So just curious where you're looking at that or what it's telling us.
I think that's a good idea. I think that's something we could definitely do to include. Again, I would go back to the case studies that we did, and a lot of those, now these again are adults who were deep in, we know they were mentally ill, we knew that they had committed a number of crimes, and again, with the information that we had, could see that they had problems in school, truancy, a lot of them didn't graduate. Again, early signs of problems there, so.
And again, when we do the diagnostic assessment, we look at learning history, we get their school records, we contact the school and indicate whether they might need some testing for learning disabilities or that kind of thing. Screen that out.
I was on the same page as you, Leslie, thinking the same thing with collective impact in mind. And with your measures still kind of at the very beginning stages of what to measure, but maybe the consideration of looking at school success as something that this group wants to do with these kids. Because again, I think we all agree there's that correlation. So it just might be a suggestion on what to measure.
I think we could definitely include that.
I had kind of a two-part question. As you look at your program, is there an ideal number of youth you want in there at any one time? And if we are in fact low, what do you feel we need to happen to increase that to get where you'd like to see it?
Well, we have a half-time case manager dedicated to the crossover youth, really coordination of the program, as well as providing the case management services. And so we were thinking probably around 8,
Okay.
10 would be on the higher side probably for a half-time case manager. We are, if we have a referral and they're open to children's mental health, we will refer to that children's mental health case manager to build a little capacity. And then our case manager, Krista Hedlund, who's in the audience here, shout out to her. She will then assist and coordinate and help advise that case manager and then make sure that they get to the review team, make sure there's a diversion plan, et cetera. So total, we probably could do 10 to 14 depending on the numbers if they were open to children's mental health.
Okay. And that may be the very last graph on page 14. Is that what you're talking about there, where it looks like maybe Chris is handling 2 of them and the case managers are handling 2? Is that what that's showing us?
Yes. So we want to kind of assess our capacity and where the numbers are going. We certainly don't. Knowing that quality case management, you have to have adequate numbers to really provide good oversight and monitoring and coordination. And so we want to keep track in terms of how many is Krista have versus how many our other case managers have. So we don't overload our capacity.
So, go ahead.
Steve, do you think there'd be a bigger need if there wasn't a capacity restraint? Do you think there are more kids that we should be working with if there wasn't the capacity restraint?
Potentially. I mean, those are conversations I think we'll have with the county attorney's office in terms of referral. I mean, there's lots of different options you can go with this program. I mean, you can do diversion at the, you know, the police contact part. And from there, we can also do diversion here. And so we can also do second time and third time offense. I mean, that's what we decided to do as criteria going. We have capacity issues here. We probably should have some criteria so we can manage the referrals. And so that might be a discussion we look at going forward.
Or expand age.
Some of the other jurisdictions that have done this type of thing, what are some of the things that, you know, they've learned from it that might benefit you guys?
Well, you know, when we went up to St. Cloud, I think what was really impressive is there was a county attorney's person who was on the team, and she had been a prosecutor for many, many years, and she was very stern in her early career, and she really believed that we need to hold these kids accountable, and she really advocated for detention and placement. And after years of doing this, she realized that was not working, that the outcomes for these kids was worse. And so I think that's something we learned, that particular person was really advocating, and I think that's real helpful. But the other thing that we learned is it just really takes the willingness of our agencies to work together, and that historically doesn't always happen in counties. You know, we all kind of work in our silos and do the work that we need to do, and I think this has been really good in that we are at the table together. We're willing to dedicate staff time, and you know, a lot of it's from the managers, but having Krista is invaluable. And in Stearns County, I'm just trying to think, they didn't have a case manager, did they? No. So at least we have the board support to give us that halftime position, and I think we'll just, as time goes on, we'll continue to grow and learn.
Dr. Redditz, you said age, and I'm going back to something Steve said in the truancy presentation months ago when he was here, and he commented on there are earlier indicators we can't get at. Is that what your comment was, or when you said age, where were you going with that?
I just meant that we've started with a small group of, you know, the young kids, not knowing what the capacity was going to be, but we could always extend that either way. Hopefully there are not very many offenders that are younger than that, but as we get experience with this, we could expand that.
So you're thinking, I'm sorry, go ahead.
Sorry. The youngest a child can be to be charged with the delinquency is 10 years old. So there's kind of a demarcation line with the juvenile justice system. When you're 10 years old and older, 10 to 17, that's the juvenile delinquency system. That's when you can be charged criminally. Younger than 10 is typically what we see in the child protection venue. So that's when we bring the parents to court to get them court ordered to participate with human services and any other needs that are deemed appropriate by human services and the county attorney's office. So that's why we have that 10 years old bottom line here where we're starting, and we're really focusing on those 10 to 15-year-old youths. We think that's, and really kind of even a focus on the young ones, the 10 to 12. To try to get them as early as possible to make the most change.
I was thinking if it works well, because we have a lot that are older that we'd like to see in the program. So if it's going well, we can extend it.
On slide, or excuse me, page 9, it's the racial demographic slide, and I think I'm looking at this correctly, but if you look at the population of Scott County, it's about 4%. African American and Native American, yet over on the crossover youth, it's about a quarter of those kids, which I know, Tim, you said is very consistent with the national data as well. I'm just wondering if this team or your group, are you talking about and thinking about from a system perspective, how do we address that, and how do we look at that, and then work with those kids in the program? Because that seems, it's pretty staggering, I guess, if I'm looking at this the right way.
Well, certainly, you know, again, when you look at the national statistics, and that was something that was in that NACO article, but other articles and research that kids that are placed in detention, and not only in the juvenile system, but in the adult system, the population in our jails and prisons also is disproportionate minority. So it's just unfortunately something that's part of our system that bias. I mean, again, we're hoping that, you know, if we're successful in diverting some of these youth in this process, that we would hopefully reduce future placement of these kids. So in that sense, it would be addressing it.
A lot of these kids in our age group are that prepubescent, going through puberty, where their self-image and who they hang out with is their life. So when they're removed from the family and put into, you know, a JAF facility or incarcerated somewhere, they're going to do what they need to do to fit in for their self-image. That's not constructive in those environments. So they end up learning behaviors that are not going to benefit them when they get back out, which starts that cycle again, because now they're going to be drawn towards people making the same decisions that they're making. And I had a professor once that used the analogy that if you drive a manual transmission car and you're burning up clutches every 6 months because you've got a teenage driver, you can absolutely take it to the mechanic and he'll put a new clutch in every month. You teach your kid how to drive a stick shift and work the clutch, you won't have to pay for that anymore. You know, so criminal justice system is there. We'll fix the problem. You know, it's a temporary Band-Aid. It's just going to burn the clutch out again. So hopefully with getting all these groups together, we start that education process so that, yeah, the clutch is going to go out sometimes, but it's not going to, you know, we start lengthening that time before there's another placement, or hopefully they're not taking any more charges.
Do you foresee working with other community groups to, like Big Brother or somebody like that, to offer more hands-on mentoring and stuff than the county would be able to offer, or partnering with them at all?
I think that's part of why we provide the case management, and the case manager would assess those needs. Would that be you know, what are the factors contributing to the offenses or to the other problems? We do, I know she's made a referral for mentoring. We do respite. We do, we try to get kids, the goal really is to get them involved in pro-social activities and whatever that takes, and sometimes that's identifying a member of the family or paying for transportation to go to grandma's for the weekend or finding mentors or those types of things. So we try to be as creative as we can to get them involved in more pro-social activities.
We've had Krista come out to all the interagency teams at each of the school districts to talk with the school districts about the program, and so they can be thinking about and preparing different kinds of community service and other kinds of activities that are more specific to the child's strengths and needs.
Realizing there's not much data, we're just getting started on this. Are there any early indicators on the 4 youth we've had so far, if we're feeling any success, or you know, just kind of a general, how does it feel like it's going so far?
There's been multiple small battles, some won, some lost. You know, we're also dealing with 10 to 15-year-olds that
Right.
even not within the program are going to make decisions
Right.
that you're just looking at them going, I have no idea why you did that.
They're really challenging our idea, what is success, what's failure?
Right.
I mean, really, and we all have kids, and we all know they get in trouble. I mean, and so we have these kids, and I think sometimes we look at them at a different lens, and so it's like, oh, you know, how do we see kids different? How do we respond differently? And what are true successes? So I think that's the discussion we're having as the team is going, how do we really measure whether we're making an impact? And that's sometimes challenging. Overall, the fact that we're sitting at the table together, multi-agencies, and talking about kids who are struggling or getting caught in the legal system and trying to find ways out of that, that to me is remarkable. And the energy around that table is so positive. My worry for is keeping that team together, making sure that we continue to see successes and find successes, making sure that we are challenging each other to look differently and find different ways to respond. So I think it's not so difficult to attach to new ideas. The challenge is letting go of our old ideas. And so that's the transition, and that's the true integration. And so as we find success as a team, I think we'll find more and more successes with the youth.
So I think what somebody said it's like a 6-month program, is that accurate?
Yep.
And you have 4 kids in there now. Are graduating from the program or successfully completing, is that all based on individual goals for them, or do you have how have you defined success for those kids that you're currently working with? Or what are they working towards? Is it just no new offense, or is there other things?
A lot of factors. I mean, whether the kids engage in the program, whether they're motivated to follow through with community service, or whether they're, have a bad attitude and throwing up their hand and saying, not gonna do it. You have to, that's information that goes back to the review team, whether they have other offenses, whether they're not following rules at school, whether they're truant, whether they're not following, whether they're having additional police contacts. And so that's all the information we share and try to go, okay, how do we look at the big picture in terms of where we're trying to go with this, and with all those factors going on, do we believe we can get there with this youth and with this family? So we expect a lot. The parents also sign a diversion agreement because we believe that kids succeed with parent support. And so we join them in that there's expectation your kid cannot succeed if you're not going to give them transportation to the therapy appointment, if you're not going to help them find community services hours, if you're not going to come to the review team, if you're not going to report back to us how the youth is doing, whether they're getting in trouble or whether they're having successes. But we want partnering in you with the youth and the parent and helping them develop more pro-social activities. So it's the big picture. It's looking at all those factors. So it's not just whether they had another offense, it's a number of things. But mainly it's engagement. If they're working with us and they're trying, and we believe there's a genuine effort, I think then it tests our tolerance in terms of how long we can hang with them with what we would call failures or setbacks.
And I wanted to say back to the success question, have we seen any? It's really, what I'm seeing so far is more on a more micro level. To see these kids engaged in the way that they are at this meeting with all of these adults in authority, and it's positive, and they're answering and asking questions, and people are, I'm holding them accountable, but at the same time, talking about their strengths and what their needs are. And for a lot of these kids, they haven't seen that kind of positive interaction with adults in authority, or at least not very often. So at least, at the beginning stages here, I think that's pretty impressive. I think our team's been impressed with that.
And it's a customized approach. It's not a boilerplate
Right.
program, but one size fits all for each kid. It really depends on what they did, what their history is, what they need. Do they need anger management? Do they need chemical health issues addressed? What type of mental health services do they need? It really is customized to what they've done and how we can rehabilitate as much as possible.
And at the current time, we're doing those diagnostic assessments and looking at individual needs, if it's family therapy, if it's group therapy, it's individual therapy. But then we're also planning through the program, as we see what the needs are, to develop some sort of group interventions that are specific to the kind of needs that are coming out in the program. We've started an adolescent anger management group with court services, and we'll be developing more of those kind of programs with parents and kids that we can use for the program.
So Carrie or Pat, do you guys go to their homes then and follow up for like curfew checks and those types of things? I'm assuming, as I've heard Tim talk about, or Pam, seems to be one of the positives of the treatment court is actually checking and following up in their own environment. Do we do those?
And right now, we have the buy-in from the Scott County Chiefs. I believe the panel's presented at the Chiefs meeting and stuff. Because it's such a new program, it's going to hopefully fall in line with the drug court, where once patrol officers are aware, hey, this is a member of this program, getting a hold of the schools, hey, are they following their rules? Were their names with the new records management system we have? It's a lot easier for us to have officers enter their names in, even if it was a non-placement issue. Mom called because their son or daughter was just not following the rules and was running around the house breaking things. Not a criminal thing in there, but it's something that we can just search me like, okay, hey, what was going on this day? It looks like you had a rough day. And try to dig that little deeper to figure out, was it something at school that happened? And what can we learn from this to step in before police even get called to your house? going out to their actual houses, we haven't done that yet. But it's just more of, that's kind of where I hope it would go, is that once, like their drug court people will get emails, hey, this is an update on this person. If you have contacts with that house, make sure that you let, you know, either myself with the Savage Police Department, we've got a couple other law enforcement agencies that are on the board as well. I'm not gonna know if a Jordan kid is getting in trouble but not getting charged. Through records management, I would hope that they would enter the name and we could just look up and see, hey, they were mentioned, they were passengers in a car that got into an accident. Okay, not a big deal. Do you guys see anything else?
Our office isn't open as far as, because they're getting diverted out of our system, so Krista's doing case management. But as far as with, I know there's other officers that sit in on the team, and I know there's, with the school liaison officers, they're doing some check-ins with the kids at the school too, so there's that connection there. But outside of that, I don't.
And sometimes it's, you know, a lot of these kids are brought into human services because of actions of their parents. So getting to talk to the student at school that's neutral ground, or at least their ground, sometimes a little bit more comfortable for them to check in and talk with us.
Now, say you've got a lot of early warning signs at the school level where there's a lot of school discipline issues, but they haven't hit the court system yet. Would those be candidates to intercept and try to divert, or how would that work?
I would personally, I would say no. I mean, we would hope, you know, we do have staff, we have mental health professionals at a number of the schools, that kind of issue could be addressed outside of the system. So, I mean, we're really just targeting those kids that now have committed a delinquency or crime that could be charged.
We do have interagency teams in each district, and anyone from the school or any of the agencies can bring someone forward for consultation, and we have community corrections and child protection and mental health and all of our case management units represented. So it's kind of a different route when there hasn't been a criminal act that we take.
So Julie, you've been really quiet. What's been your role so far? We're not going to let you off the hook.
Yeah, Julie.
I guess the child protection piece of it is, I mean, really it's the information sharing. So if we've had involvement kind of going through and looking at those records, or maybe if there's an open worker, that supervisor is present for the meeting and sharing like our perspective and our work, and being open to trying to figure out what are ways that we can sort of leverage our authority with the parents to kind of help support success or be challenged in our own thinking about how we might expand or look at our work with the parents a little bit different. One of the things that did happen, Steve and I had a meeting with a family that was having some challenges within this and trying to talk with the parents a little bit about where things were at, and it wasn't looking too good. And I will say, even though we had that hard conversation, the parents they're thankful for the program. I've heard more parents than just these saying, we're thankful for this program. You know, we wish it was around when I was a kid, or, you know, earlier with another youth or something like that. So even in some of the challenges, I think the parents are also thankful for it.
Other questions from the panel? No? All right, we'll open it up to the audience. I think Tracy has the mic there for folks to ask questions. Oh, you can't be quiet.
It's great when we answer all the questions.
All right, quick question for Sarah, actually. Tim mentioned the piece about the Stearns County and kind of the mind shift for the county attorney's office, and just kind of understanding the role of the county attorney's office in these kind of things. How has that been for you, and is that a challenge for your office to look at something like this, or are you just curious on your perspective?
Thanks. No, that's a great question. Certainly, it's definitely a paradigm shift for how we look at cases, but it's not. This isn't novel in terms of a diversion program. The only difference with this piece is now we have the mental health social services component that goes with it. We, in our county attorney's office now, we have a juvenile diversion program for first-time petty offenses that come through. So we certainly have the understanding that, yes, we need to do what's in the best interest of this child when we're looking at these charges that come in. But we also have other responsibilities and accountabilities that we have to look at too. Specifically, one of the issues that has come up here is when we have victims. And so when we have a case that's involving harm that has been done to another person, especially when it's outside of the family unit, that gets a little tricky for us to get their input and figure out, well, is this going to be an appropriate thing to do? Because we have to look at the big picture, not just this juvenile and their family, but let's look at the public as well. So that's been something that we've had to discuss with our team internally. We're still in discussions with our group, and it's kind of an ongoing discussion that we're having to figure out what's the best thing to do for everyone involved. Specifically with Stearns County and their program, they have not quite a broad view that we do in terms of the cases. They are primarily domestic abuse cases that are inter-family cases. So we're not looking at, in Stearns County, the general public being affected victim-wise. So that makes it a little bit probably easier for them. We have decided here when we were planning our group that we were going to be open-minded with first-time offenses and just see what was appropriate and try to figure it out as we go along. And I know that's not maybe the greatest answer that everyone wants to hear, but we were trying to be open-minded so as to figure out how we can best help these kids that come through. So it's just a lot of open-mindedness, I think, on our part to try to determine how to best divert these cases. Which cases should we divert? The county attorney's office has a lot of control, and that's a good and a bad thing. We are the ones that the cases come to us for review. Is charging appropriate? And that's something that we do with any case, diversion or not. Is this something that we want to go forward with? Is this going to be the best interest of this child? And once we make those decisions, that certainly has long-lasting ramifications on everyone, and so we don't take that lightly. But I think our biggest thing is just trying to make sure that as a community, we're doing the right thing and we're holding these kids accountable. One thing that I do like about this program is that the contract that they're signing and the different conditions that we're imposing on them sometimes are more than what they would have in the court system. And so that's something that we can tell victims, look, we're talking about kids here, and I don't want to diminish what has happened to you as a victim of a crime, but we're talking about a child here that may need some pretty extensive services so they don't ever do this again to you or to another person. And I think that everyone really gets that. So I hope I answered your question.
Can I ask just, how many people, or who makes that decision then to do that?
To do which part?
Well, you were talking about the prosecutor or whatever. Who, is it just one person or?
The county attorney's office is the charging authority for any crime that comes in.
Okay, so is it just one person makes that decision, or is it?
Well, one prosecutor is responsible for each case.
Okay,
Yes.
and they would make that decision, one person
Yes.
possibly? Okay, oh, okay.
And we troubleshoot with each other
Okay,
in our
okay,
different
okay, that's
divisions,
what I'm
so
wondering. Okay, I
absolutely.
see. Yep, okay.
Other questions from the audience back here? Judith, nothing? All right, Mr. Chairman, we'll turn it over to the board.
No, thank you, Leslie, and panelists for the description of what's going on. I remember some of this discussion in workshop over the past couple of years, and so it's interesting to hear how it's beginning to develop. I'm going to ask the commissioners if you have some comments too. I have just one thought that was occurring to me as I was listening to this. I remember a presentation by, I think Jim Murphy used to be the principal at the high school. His wife was involved in something called Restorative Justice, which was an amazing program, I thought, where they would try to divert kids that, particularly with an eye to the justice part. Because, you know, when we have somebody who's done something that the attorney's office is thinking about charging with, it infers that a crime was committed somehow, which implies that there was a victim. And, you know, we're looking for justice as victims. Somebody broke into my car and, you know, stole my dashboard or whatever. And so now we've got somebody that we think probably did that. How do we tie the two together? How does justice play the role here? How do we involve the victims in this, or is it at this level? And do you see any, I'm going to editorialize here for a moment. I think one of the beautiful things about restorative justice was it brought the victim, who was just minding their own business, together with somebody, some miscreant who just did something stupid. And there was an opportunity for not only the system to come down on the perpetrator, but the victim to express forgiveness at some point if there was sorrow or I'm sorry, an apology offered or whatever, which seemed to really kind of help cement the change in behavior, which is really what we're looking for here, if I'm not mistaken. If any of you care to comment on where that fits in or how that all works as we're looking at the goals and objectives here, I'd be interested to hear you explore that a little bit. Or perhaps you have and you've missed it.
I can comment at that from Carrie and our perspective in corrections. Restorative justice has been around for quite a few years. Mm-hmm. And again, the idea that when somebody commits a crime in the community, we want to repair that harm. Mm-hmm. And so I think it's a little bit of a paradigm shift in terms of this process in that you can still repair the harm. It doesn't necessarily need to have a formal charge or having that juvenile adjudicated. Mm-hmm. So that's something I think we can work on. You know, if there's concern from the county attorney's office that how can we hold that juvenile accountable and still restore the victim, I think there's ways we can work that out. So whether Good. It's a letter of apology, paying restitution, or an actual formal meeting with the victim, I think those are things we can build into the program and still having that justice served.
You mentioned damage done. Yes, you know, to the fabric of society, there's been a tear, intentional or otherwise. Part of that, mending that is, I think the victim has a role to play if they want to in this whole thing. So I'm glad it's being considered. Thank you. Fellow commissioners, let me go to Commissioner Beer, and then we'll go to Commissioner Brecky. So.
Yeah, I just want to dovetail on that. Thank you. So the two things that I heard, Steve, you said earlier was the diversion plans, which I think were maybe the behavior modification is how I interpreted that with the victim letters, helping them understand the consequences of actions, which is sort of the behavior modification piece of that. And then you mentioned something you wanted to let these people know, as I was going to say guys, because I see this graph, it's usually the guys that are in trouble, but that's another day. There's hope for you.
Right.
How do you, because behavior modification is awesome, but I see this, you know, when you instill hope back into someone's life, that propels them beyond just modifying their behavior, that maybe it modifies it for a lifetime. What's the secret sauce, and how do you deliver hope back into some of these people's lives? I mean, you just mentioned it, but it's for, you know, everybody. Because to me, you know, there's those old lab rat, I hate to mention they're lab rats, but those old studies from Johns Hopkins of hope. So how do we instill hope back into humanity so that they don't have all these stays that we see on these graphs? And they last beyond just a year. But for a lifetime, they're productive members of society because they are living for something bigger. So what do we do? How do we aid in that process is the question. And if there's not a simple answer, I know there's not a simple answer.
I think there's some answers. Some of the research shows that youth who perceive the process to be unfair and unjust and disrespectful are those youth who are at greater risk for reoffending. And so, you know, when the youth come in and meet with us, it's not, all right, kiddo. It's, hey, thanks for coming, number one. Really brave for you to come to our group. Number two, we want to join you. We want our hope for you is that you have success as an adult, you graduate from high school, that you have quality relationships, that you enjoy life, you have interest, and you're part of the community. So we share that hope for you. Is that something you're interested in? And they kind of go, what? well, we're not getting hammered? Oh, and you can see youth kind of coming in this way, and then when you start to support them and say, we respect you, we want this to be fair, but you did do something wrong. But and you have to somehow make that right. And so I think that the special sauce is how do we balance justice, and how do we see these kids as children and adolescents, and how do we respect them, be compassionate, and hold those both in one hand and say, we're going to travel the road with you. And we're going to have tolerance, we're going to have patience. You're probably going to mess up again because that's life. We all mess up. But you're going to come in next time, we're going to talk about that. We're going to talk about what was successful, what's helpful, what gets in the way of your success, and what do we need to do differently. And so that's the process of trying to travel down the road with them. And look them in the eye and say, we're sincere about this, that we really want this to go well. And if you're not following the rule when you go home, we're going to talk about that too, because you just said that your dad's concerned about that. So we have real conversations, but we do it in a way that's compassionate, we do it in a way that treats them as human beings, and we try to put some teeth in it, but genuine. That it's always with the intentions of trying to help.
Yeah, I would like to add to that is that I spent 3.5 years working at a middle school where kids are in crisis 8 times a day. And if I had to pick a secret ingredient, investment. That is the secret ingredient. These kids, a lot of them have been passed over. They've been talked down to. When they truly understand that you're making an investment in them and you're talking with them and not at them, that's when that head starts coming up. They're like, oh, so you actually were paying attention to what I was doing? Okay, now I'm starting to buy a little what you're selling. And then, you start going on and they'll test that water because they've had people that aren't invested in them. So they'll check up, they'll see, are you paying attention to me now? Yep, paying attention. Remember you did that thing? Well, crap, now I can't get away with it. Okay, cool, now, and then it starts that ball rolling. As well as we're acknowledging those small accomplishments, as opposed to they've probably been told, you did this wrong, you did this wrong. Yeah, we'll address it, but you did this, this, and this right, and this is where we want to go. And once they start feeling that investment, that's when it's going to start.
Then perhaps maybe as the parents hear these messages coming, they go, oh, maybe there's a different way to interact with my child. Maybe there is some good there. Maybe they do have abilities, and maybe showing respect maybe get some. And so if we have concerns that parents perceive their kids as all bad and all wrong, and they can't change, like Julie mentioned, that was one of the hard conversations with parents the team reviewed. At hearing mom and dad went, whoa, this is not about the kid. We have some real concerns about parents. So we scheduled a meeting and said, hey, we want to share that we think this is bigger. We think that you have a role in that. We think that, lots of positives. Engage them in terms of what we think is going well. But also, here's what we think is part of the problem. Is that something that you can have a conversation with us, and is that something you're willing to work on and get our support around? So we try to be transparent. We try to be respectful. We have hard conversations, and we're still new. So I think the feedback and the conversation kind of lights light bulbs, and kind of go, oh, there's a lot of hope in terms of improving things down the road.
And that's the other piece about hope, is that if you see these kids from the outside that get involved in the correction system, they get in so deep, and they know what they're supposed to do. They don't have a way to do it. So this team makes a workable plan. Like, you need to do this, you need to have these consequences, you need to have these corrective kind of behaviors, but here's how you can do that in chunks and pieces and things that they can actually do, rather than just being overwhelmed with it. And also, there's this whole team of people that are paying attention. And as they said, their heads just come up, it's like, oh, these people are actually going to pay attention not only to what's happening now, but what happens tomorrow and the next day. And so it's more of a team approach.
And the secret sauce is understanding the brain development. Good news is a lot of kids grow up and out of the system as their brain develops, as they develop self-control and develop an identity, a positive identity. They just simply grow up and grow out of the system. Now kids who are crossover youth have more complexity, at more risk of staying in the system, and certainly if they have trauma, they're even more at risk. So our hope is, hey, your brain's still developing. You can change literally the pathways, but that's repetition. So how do we join parents in that and develop a system of support that moves kids in that direction?
And one last thing I'll say is that, so we know that kids who have had this crossover experience, that have had the history of trauma, once they come into the juvenile justice system, and a lot of times they get detained, that adds to the trauma. So if we can intervene at the very first offense and deal with them differently in a more helping, holistic approach, and avoid as much as possible that reaction from a system that, oh, we've got to lock them up, we got to detain them, you know. No, we don't have to. Minimizing that future trauma of putting a kid out, placing them out of the home and placing them in a detention facility.
Secret sauce is just knowing what makes things worse. Research is really, really good. We're getting more and more research. And Scared Straight, remember Scared Straight? It used to be the program, and that was the thing to do to kids. Well, guess what? That was wrong. It increased risk. And so we're learning the things that we used to do were increasing risk. So part of the secret sauce is, let's not do what's not effective anymore. Let's figure out a different way of doing it.
Mr. Brecky.
Well, I have lots of notes as usual, but I'll get to those later. One quick question and then one a little bit harder question. First, just as far as the eligibility and the interaction with human services, can that interaction from the child's family just be economic? I keep hearing about mental health and child protection, but if they have a file just economic assistance with human services, are they eligible for this program?
They would not be.
They would not be.
So social services, so like either child protection, children with mental health, those kind of case management type programs.
Okay, just thank you. That helps me with the kids. And then obviously the parents and the families a big piece of this puzzle and a part of the success. But I'm sure if not already, there's going to be kids who need this program the most, who that's just never going to happen. Maybe they're in foster care, they're already placed somewhere, or that parent doesn't have, they're just not going to be there and be part of the team. We talked about the parents having to sign on, arrange transportation, get to therapy, all that. Is this program have a home for those kids, and how are we going to address, because from a long-term standpoint, that's probably who needs it most, and if we get into saving money long-term, that's...
Those kids would be eligible, yes. If they're in foster care and there was a charge, county attorney's office reviewed it, said they would be appropriate for the program, yes. If there was not a parent to sign off on that. Now we try to, that's more of the intention of the parent diversion is more an attempt to engage them, saying, right, a serious deal, lots of implications, and your support is really needed. Now, where there was a serious barrier that we couldn't get that, and we really believe we could still be effective with the youth, we're going to have that conversation, and we're going to say, what's it take without a parent support to do that? Can we help this youth? And if we believe that, we're going to have the youth come in.
Good. That'd be interesting to hear more about. So thank you. I think with such a new program, you're brave to be up here to this questioning, and I really appreciate before you came up, you identified so many of the things that yet you haven't gotten to yet, which makes sense with the new program. So I'm really interested in, that's one of the notes I wrote down where you made the list of the missing links and challenges, and this would probably be true to every Scott County Delivers program we have, that we get some kind of follow-up, because that's some of the greatness of this exercise is you identifying them beforehand, and then to see what kind of progress is made on them would be great. Thank you.
Okay, any concluding comments or remarks? Administrator Shelton.
I had one question, which really is not as germane to this program, but perhaps to children's mental health and the child protection programs. You know, you commented that a lot of what may drive kids, these crossover youth, to be delinquents is the trauma that they experience through other processes. Do we do anything to look at before they commit a delinquent offense? Because I think we all know that kids have a tendency to learn what they live. You know, they're imprinting as things go along. So when we have kids that haven't committed a delinquent offense but are engaged in child protection, are we doing something to look and see what type of imprint? You know, I know that the focus of child protection is to make sure that the child is safe, and there's also the hope to reunite the family. I mean, the ideal goal is the child is safe and they get back to their family. So if that happens, that's ideal, but there has been a trauma and some type of imprint, and do we look at as part of that process so that perhaps we provide some assistance to that group even before they have that delinquent offense? Because I do agree. I think that it's the trauma. You know, if you're 3, 4, 5, 6, 7, 8 years old and you experience a lot of trauma, that may come out when you're 10 or 11 and in other behaviors. So not necessarily germane to crossover youth, but just something to think about. Is there a way that we can provide some level of service to those kids who have suffered serious trauma? And we've worked out something where they're now safe and they're with, and maybe we've unified the family, but is there a step that we can go so that there doesn't end up being that victim? So that, as Commissioner Bear would say, we're helping them to reestablish that hope even before they commit that delinquent offense. Because a lot of that does seem to imprint long before they reach that 10-year-old stage.
At the mental health center, we get many referrals from child protection and from the schools and from parents and community corrections, actually, for trauma therapy.
Okay.
So we have kids as young as 2 that are doing trauma work at the mental health center now.
Okay.
And there's lots of research out there. The state provides lots of training. So it's important that the case managers are informed of trauma and the implications, how to identify that, and we include that, integrate that into our assessment, and have conversations with parents and mental health providers, and so it's an ongoing conversation. What's driving these behaviors? And trauma is usually the first question we're asking. Does this child have any trauma? What's that look like? And then what needs to happen to help the kid move through that?
Okay. Thank you, Leslie and the team, for your for that presentation and for that. And keep up the good work.